Thank you. So today, the doctor got me in here just to teach you about the medication you've been prescribed today, okay?
Oh, good. I have a few questions about this medication. The doctor wasn't so good at describing what it would do for me.
Okay, perfect. I'm just going to pull up your file here and we're going to have to chat. Okay. So it says here in your file you've been diagnosed with COPD this morning and your doctor wants you to start taking Ventolin. Does that sound right?
Yes, that's what I got from this morning.
Okay, perfect. So Ventolin is a fairly common medication and it just kind of opens up the airways in your lungs and helps you breathe better.
So it's not going to fix my COPD then?
No, science hasn't quite worked out a cure just yet. So your normal dose for this medication will depend on what the doctor has prescribed you, but he has prescribed you the normal dose, which is 2 puffs every 4 to 6 hours, or 2 puffs 15 to 30 minutes before you exercise. But if you get relief from just 1 puff, that's fine, and you don't have to take the second one.
Okay, my doctor showed me how to use my puffer and spacer. It follows the same routine as the diagram in the back of this manual.
Wonderful. Always be sure to use your spacer. You get much more medication from the spacer, which will make it a lot easier for you to breathe. And if you forget to take a dose, go ahead and take it once you remember, but if you're short of breath after you've taken your dose, call the clinic, but if you feel like you can't breathe, be sure to call 911 or get someone to take you to the hospital. After taking this medication, you might get a little bit of a bad taste in your mouth, so you're going to want to rinse your mouth out or brush your teeth, but if you are rinsing your mouth out, be sure to spit the rinse out, don't swallow it. It could cause an oral infection called thrush, and you just would come into the clinic and we would get you treated for that.
Okay.
And if you start taking any herbal medications, be sure to call the clinic and we can tell you if they're safe with this medication or not.
I take a women's multivitamin, is that okay?
Yeah, that's great. You should keep taking that to make sure that your bones are healthy. And it says in here in your file that you don't use any non-prescription drugs or marijuana, is that correct?
Just my multivitamin and my flu shot. Sometimes a glass of wine here and there with my husband.
Okay, that's great. Your flu shot is very important and the glass of wine is okay here too. So, and it says in your file you don't have any prescribed medications, that's right, just the Ventolin?
Yep, that's right.
Okay, great, Lisa. Now in your file it also states you have no other conditions, is that right?
Nope, thankfully not.
Okay, good. And at this time there isn't a link between the medication causing any harm if you were pregnant to your baby, let's say, but if you're planning to get pregnant or become pregnant, we want you to come into the clinic, all right?
Okay, my husband had a vasectomy years ago. Thank goodness I don't have to worry about that.
Wonderful. If anything changes, we're just a phone call away. Now, like any other medication, Ventolin does have some side effects. These include nervousness, restlessness, tremors, chest pain, and palpitations. And I see in your file that you drink 2 liters of Coke every day. Is that right?
I do. I try to stop every once in a while, but I just love it so much.
Okay. With this medication, the caffeine content in the Coke are going to make the side effects much worse. So your heart will race, your tremors will be stronger, you'll be nervous, and the nervousness and restlessness will be exaggerated.
So I shouldn't drink my Coke anymore?
With this medication, it's really best if you don't. If you need to wean yourself off the caffeine, you can take a low caffeine tea in the morning for about a month or a couple of weeks, just so you don't get any caffeine withdrawals, but it's ideal to be off caffeine while you're on this medication.
Okay, maybe this medication is all I need to break my cola habit.
Perfect. So, and some of the serious side effects of this medication that you'll need to come into the clinic for are paradoxal bronchospasms and low potassium levels. So, the paradoxal bronchospasm means your breathing or wheezing will become worse rather than better after you use the medication. It can be life-threatening, so you should get yourself to a hospital if you have coughing, difficulty breathing, weakness, or shortness of breath after this medication.
That sounds sort of scary.
It can be. The side effect is not common though. It may happen, but this medication is what's best for your COPD. Now, this medication may also cause low potassium.
What does that mean? How would I know?
So, potassium is an electrolyte that is very important for your body to work. If your potassium gets too low, you would have a low urine output, irregular heartbeat, dry mouth, muscle pain or cramps, mood changes, numbness or tingling in your hands or your feet, and you could have convulsions. Again, this isn't a common side effect, but it's important you know the symptoms so you know when to call the clinic so we can make sure the medication and the dose is right for you.
I'm so glad you told me all this stuff. I think you answered all of my questions.
Well, that's what I'm here for. I'm glad I could answer all of your questions. Are you sure you don't have anything else I can help you with before you head home?
I can't think of any other questions. Plus all the information is in this booklet too, right?
Perfect, yeah. And the number to the clinic is in the back of the booklet. Thank you so much.
Thank you so much.
Awesome.